We now are moving to look at some of the international experience that we can learn lessons from and get a sense of what's possible into the future. So the first international case we're looking at is from the Netherlands, and looking at social farming sector in the Netherlands. And we're joined by Marjolein Eelings and Martin Fischer. Marjolein is a research scientist at Wageningen University and Research Centre in the Netherlands, specialising in research on agriculture and care. The Netherlands, as we know, is the most developed social care farming sector in Europe. And Marjolein is one of the most, is the preeminent researchers and thinkers on social farming in Europe. Martin is director of the Dutch Federation of Care Farms, representing more than 900 care farms. Martin has started care programs in the US and combines his current work with jobs for two different foundations that support innovation in healthcare and the development of care farm programs in the Netherlands, Israel and Switzerland. And Martin also has a historic connection to Ireland, having been here quite some while ago, 25, 30 years ago. So Martin and Marjolein.
Well, first of all, thank you for your introduction. And I think it's really great being here and hearing all the experiences in Ireland. And I actually would like to have the chance to take you to, as Joan would say, a boat trip, but then to the Netherlands. And that actually started 30 years ago. Yes. So if we look at the Dutch situation, the trip started 30 years ago, and it was a swiftly growing sector, which comes to a stable market at the moment. To give an idea, in 1998 there were 75 care farms, while there are 1,300 at the moment, and more than 30,000 clients visit those farms every year. And at the beginning of this development, we see that the farms were mainly focused on people with learning difficulties. But at the moment, the variety of target group is very diverse, from youngsters with behavioral problems, children that dropped out of school, people recovering from addiction, or people with mental ill health issues. And with this variety of target group, also the forms of care that are offered by farmers also is very diverse. For instance, they provide useful day activity to labor reintegration, and from respite care to also vocational training. Well, and this development took place the last couple of 30 years. So we also had a lot of struggles, of course, in implementing this sector in the Netherlands. And I would like to highlight some key milestones, starting in the 90s, because then what we saw, there were care farms that were like isolated initiatives that had a lack of legitimacy and also had no financing. And the end of the 1990s, we saw that the policy of the Ministries of Agriculture and Healthcare changed. Agriculture, the Ministry of Agriculture would like to have the agriculture more closer to the citizens and consumers. And while the Ministry of Healthcare would like to have people with a disability should be more part of society. And so both ministries were actually looking for, as I would say, I'm not a native, socialization of agricultural and healthcare. And what the care farmers offered actually fitted very well into those new policy view. And therefore in 1999, the National Support Center of Agriculture and Care started, financed by both ministries. And that support center actually started the existing or supported the existing farms, but also stimulated farmers to start a care farm. So that's like communication, they lobby activities, they made a database. So and a website, so all care farmers in the Netherlands were visible for everybody. And they set up a quality system and a handbook. Well, and another key milestone was actually in 2003, because there were major changes in the regulation and financial systems of the healthcare sector. So people with a disability got the opportunity to have their own personal budget. And at that time, we see that more clients or participants were using that budget to have a direct contract with the farmers. And this causes that the number of care farms increased in the Netherlands. And in 2005, we had the liberalization of long-term healthcare costs. It's a long term, but, and with this, also care farmers were accepted as formal care institutions and have their own accreditation for general health costs, and could have a direct contract with municipalities in providing care. Well, and if we see in 2007, the National Support Center stopped because the finance of the ministry stopped as well. But the care farmers united themselves in 2010 in the Dutch National Federation of Care Farmers. And what we not only saw is that we have a national federation, but every region in the Netherlands also have their own corporation of care farmers, in which they do the general things like lobby activities with municipalities, administration, having the accreditation for the general healthcare costs. So we see that every region has also their own corporations, and that's, I think, also very successful. And next to that, also care farmers were looking for other services, so not only to providing day activity, but also looking to other target groups, like giving vocational training or having links with other sectors like education. And I think that was also very successful. And the last milestone is, I think, the research collaboration. We have a long collaboration as Wageningen University together with the National Support Center and the Federation, and with a lot of other corporations of care farmers. It's just like here in Ireland with University College of Dublin, I think. And, well, I would like to tell something about that research. Because in 2008, or around 2008, there were 3 main big and large effect studies done and financed by the ministries. And those effect studies were real large quantitative studies, also qualitative, but in which we followed clients for more than a year, sometimes more than 1.5 years, to see how they were doing on the farm. And these studies were very important in providing the evidence base of care farms. And actually in 2012, I know Maarten was there as well, because you were the coordinator of the Task Force Multifunctional Agriculture. We together wrote a report that combines all the findings of those studies. And this was actually distributed among all the municipalities in the Netherlands. And the preface was even written by the CEO of one of the biggest healthcare insurance companies in the Netherlands. So to show what kind of impact the care farms have on the participants. And to give a brief idea, because I only have 10 minutes, to show what kind of impact we found from those effect studies, we see, for instance, with elderly with dementia, we followed them for a long time and also compare them with regular day care facilities. We see that there was a positive, significant change in their dietary intake in comparison with the regular daycare facilities. And if you all know, malnutrition for elderly with dementia is an issue. So this is a very good positive effect. And next to that, for this target group, we see that the farm environment also causes that elderly do more physical activities than in the regular daycare facilities. And so they maintain their physical condition. And next to that, of course, it's also a relief for their informal caretakers as a form of respite care. And then we did a effect study on youngsters with behavioral problems. They were there in a special program for a year on a farm. And, well, it's a very large table, and sorry that it's not so good on the screen, but what we found out actually is that in comparison with the start and finish of the program and also the follow-up, we see that the youngsters that were on the farm showed after the program less problematic behavior and their self-esteem improved. Also, they had a better contact with their parents and used less drugs and also had less contact with the police. So that were very important findings in this study, and it was also the social workers told us that it was a huge effect for these youngsters. And at last we had an effect study on the target group people with mental ill health or addiction history. What we see is that people that were working on the farm got a better physical condition because they used less medicine and drugs. We see that their appetite was better because they do physical work, they eat together, they eat fresh food that they grow themselves. And after a day working on the farm, they feel really tired, you know, like some of the participants said, I feel really tired, not of tired sitting just a whole day on the couch, but just tired, and therefore I sleep better. And also their self-esteem and self-respect grow on the farm because they are appreciated by the farmer. And they feel useful and have a target for the day, and they see positive results of their work. And also what we see is that their family and friends are looking differently to them, because if you're on a birthday party, often one of the questions is, what is your name? And then the second one, what do you do? And it's so important that people said it was so nice to say, I'm just working on a farm instead of just sitting at home, you know? It's really boost for your self-esteem. Well, I'm very glad that all the other speakers already told a lot about the impact on the participants. So I would like to conclude in this figure, actually, because if we look at all the results of our research, we see that the care farm combines 4 main qualities, and that is actually the attitude and engagement of the farmer and supervisors. For instance, we see that the farmer and his family are always there, so that gives continuity in the care they provide and also safety for participants. And also the farmer has the emphasis on what people can do instead of what they can't. Then we see the useful and diverse activities. Well, it's already said that participants feel useful on the farmer is waiting for their help, and the activities are already naturally there, they don't need to be invented. And it also gives people the possibility to learn new skills and competences. Well, and on the farm, people are a part of a community that not only consists of the farmer or the farmer's family, but also consists of the wider community, because the farm is part of the village and people are coming there as well, and they are going to the village. Well, and at last, the green environment. The green environment helps people to recover from stress, improve their concentration, and it's also often an environment that's they are not totally used to, because a lot of participants live in the city and there they often get overstimulated. So if we look at those 4 main qualities, we can say that the care farm offers different target groups, an informal non-care context that is really unique in a healthcare sector. So, and with this, I would like to end my presentation and would give the floor to Maarten.